This is Tori and Sarah, and today we're going to be talking about the knee. We're going to start with range of motion of knee flexion. So you're going to take your goniometer, and the immovable arm is going to be lined up with the greater trochanter of the hip, and then the fulcrum is going to be lined up with the lateral epicondyle of the knee, and the movable arm is going to be lined up with the malleolus of the ankle. So, you're going to have your patient, once everything is lined up, go ahead and bend their knee. And you can assist slightly and push the knee in as far as they can. And then make sure that everything is re-lined up where it needs to be. And then take that reading. And that's great. Sarah is at 138, which is right in that normal range of motion of 135 to 150.
And now we're going to be doing range of motion of the knee extended. And to start off, we're going to have to place a towel under the ankle in case there's any hyperextension of the knee, and we'll be able to see it clearly. So we're going to take our goniometer, and it's going to be the same location as knee flexion. So the stiff arm is going to be aligned with the greater trochanter of the hip, while the middle part is going to be aligned with the lateral epicondyle of the knee, and the movable arm is going to be placed at the malleolus, aligned with the malleolus. And I'm going to go eye level here, and now Tori is going to extend her knee. And Tori is at 4 degrees, which is right within the normal range of 0 to 10 degrees, which is great.
All right, so now we are going to do the manual muscle test of knee flexion. So you're first going to have your patient lie in a prone position, and then you're going to first stabilize the hip and rotate the foot medially. And then you can palpate the semitendinosus and semimembranosus. And then if you rotate the foot laterally, you can go ahead and palpate the biceps femoris. And then you're going to have the patient come up into slight flexion, and you'll apply resistance to the lower half of the leg in the direction of extension and have them resist you. Awesome. So she would score a 5 for that, which means that she can do the range of motion well and resist well without any difficulties.
Hi, now we're going to be doing the knee flexion gravity eliminated manual muscle test. And to start off, the patient has to be laying on their side while one leg is held up. And I'm going to palpate her biceps femoris and her semitendinosus and her semimembranous while she does the movement. She would score a 5 on that as well, which is great.
So now we're going to be doing the manual muscle test of gravity resisted of knee extension. So we're first going to assess the patient's range of motion. So go ahead and go through that. Awesome. And then we're going to have them come up into almost full extension, but still be slightly flexed. And we're going to apply resistance in the direction of flexion while the patient pushes up. So go ahead and do that. Awesome. And she would score a 5 on that.
And now we're going to be doing the manual muscle test for knee extension. So the patient should start by laying down on their side, and I'm going to hold the upper leg up, and I'm going to palpate the quadricep muscles, which is the vastus medialis, the vastus lateralis, and the vastus intermedius, and the rectus femoris, all of those muscles, while the patient does the movement. Good job. and she would score a 5, which is great.
So there are a few different knee injuries that can happen to the knee, and one of them is a tear of the lateral collateral ligament, which is a varus stress on the knee, and that is when a force is applied medially to the knee, which causes the force to be transferred over to the lateral side and cause that tear.
Another common injury is a tear to the medial collateral ligament of the knee, and it is due to a valgus stress. And a valgus stress is when force is applied laterally to the knee, causing the force to be transferred medially.
Thank you for watching, guys.
Thank you for watching.